Eric, let's go to the data. Well, as you can see, the numbers continue to go up. Today, we're reporting 2,425 new cases since yesterday. This is the highest number we've ever reported on a single day since this started in Ohio 7.5 months ago. The highest before that was yesterday. Of the 10 highest days of new cases reported, 8 have occurred in the past 9 days. 9 have occurred in the month of October alone. And quite candidly, what is most scary about this is that it does not seem like we're even starting to get to a plateau. It just goes up and up. We have 12 deaths reported since yesterday. In addition, there were 159 new hospital admissions, the third highest we have reported so far, and 25 new ICU admissions. Eric, let's go to our hospitalization slide and look at that for a moment. These are the current number of COVID-19 patients that are in the hospital. This is what this chart is. It's really a hospital count. This is one of the really most important indicators that we have. It's a lagging indicator. It's late, obviously, well after someone is diagnosed many times. Although in Chris Christie's, it was not. It was, apparently within the same day. This number has been trending higher for the past several weeks. For example, on October 9th, see if I can find October 9th is back here. So October 9th is the first part of that. October 9th, we had a total of 853 COVID-19 patients in our hospitals in Ohio. Today, that number has grown to 1,293. We certainly must prevent overwhelming our hospital system to ensure that Ohioans can receive inpatient treatment for COVID-19, but also we have to have room for other people, people who are there for serious accidents, car crashes, strokes, and heart attacks. That's why this number is certainly something that we keep our eye on. Eric, let's go to the Public Health Advisory System numbers. There's really two things we ask you to look at. And if you're looking at for your school district, if you're looking at for your community, really two big things to look at. This is the first one. This is where your county ranks in the last 2 weeks in number of cases per 100,000 population. As you can see, the blue part continues. And the blue part, the blue shaded counties are high incident counties. When this started, we had a handful of counties that were high incidence. And we've gone through this at different points. Today, as you can see, it's virtually takes all the way over to here. All of these counties are high incident counties. Again, that means there's over 100,000 per 100,000 cases is how that is measured. We'll get into some numbers in a minute. We continue to have more and more counties exceed the CDC's threshold for high incidence. As we talk about our high incidence counties and the alert system, we need to remember that the incident list shows you how quickly the virus is transmitting in our communities. For example, let's go to this is the first top of the list. We'll go back, Eric, to previous one. We'll go this one. Putnam County, you can see 186 cases that they've had in the last 2 weeks. But they are at 5.5 times what the high incidence rate is according to the CDC. 5.5 times that number. And you can see as we go down to Auglaize, Mercer, Jackson, Allen, you can just see, the high incidence is 100. And you can see these are, 5.5 times, 3 times, some of them 2 times. So very, very high. Let's go, Eric, let's go look at the next slide. This is the other big indicator, which is our color slide. And you can see this is where we were last week. And this is where we are this week. And let's go to the next slide. Eric will show just that. So this is where we are this week. Today we have an alarming number of counties that are red. 38 of our counties are red. We also have 3 counties that are now on the watch list, which means that they're between red and purple. That's Clark County, Cuyahoga County, and Hamilton County. This is an increase from 29 red counties last week. And 3, as I said, 3 on the watch alert. Watch alert simply means that all the indicators would indicate they're purple this week, but we don't post them as purple until they've done it for 2 weeks straight. So we don't know if they're going to turn to purple or not. We'll have to see what happens between now and next week, and then look at next week's numbers. The new red counties are Allen, Crawford, Cuyahoga, Hardin, Lake, Lorain, Ottawa, Tuscarawas, and Wayne. 5 of these counties are red for the first time: Crawford, Cuyahoga, Lake, Ottawa, and Tuscarawas. This is we've continued to show this, and here we are this week. This is the percentage of our population that is red. And then you see down here some in the orange, and then very, very small cases now, few cases that are actually in the yellow. This means that the virus is spreading throughout all the regions of the state. It's penetrating everywhere. We now only have 4 counties that are yellow. This is the highest number of red counties, the lowest number of yellow counties to date. This means that 74% of Ohioans are living in a red county, 74%. Only 1% are living in a yellow county. Now let's go back, let's show the alert map. Here again, 92.8, almost 93% of Ohioans are living in a county that is red or a high incidence county. I mentioned before that every week that I have a call with local health commissioners, and we did this past Monday. And every day members of my team are reaching out to these health commissioners as well. What we're hearing from these officials from all over the state is, of course, what we know, that Ohioans are tired. They're laying their guard down. They want to see friends and family. Let me share a quick example of what we learned about from the local health department that illustrates why we just don't have the luxury of letting our guard down. During the summer, as it got increasingly hot, a factory allowed its workers to remove face coverings. Unfortunately, the employees did not start wearing masks again when it cooled off this fall. Now there's an outbreak of 25 employees that crosses 2 counties with at least 2 hospitalizations so far. These stories continue throughout the state. And again, it is when we let our guard down. Chris Christie's story is really speaks volumes about what can happen. You can be very, very careful. You let your guard down for a relatively short period of time, and then boom, there it is. I want to talk about our watch list counties, and the first one will be Clark County. Clark is at a very high incidence, 251 cases per 100,000. What you're seeing in these watch counties is sustained increase in outpatient visits for COVID-like illness, sustained increase in hospitalizations, sustained increase in emergency department visits. So several of these are very early indicators, and they have to do with what's going on in the hospitals. Clark County is on the watch list for the first time since the alert system started 4 months ago. The county also exceeds the CDC's threshold for high incidence. Local health department officials report that there are 30 people hospitalized for COVID. They also report that they have a number of cases from long-term care facilities, but that much of the spread in the community is coming from people getting together with friends, just laying their guard down. We're seeing transmission throughout the county. Let's go to Hamilton County. Hamilton County is about the same level of cases. They're at the rate of 234 cases per 100,000 residents. They returned to the watch list this week. The county exceeds the CDC's threshold for high incidence. They're seeing growth in new cases and growth in hospital admissions. Local health department officials have told us that they had more new cases reported during the past weekend than any other weekend throughout the pandemic. And they were reporting their highest number of cases and hospitalizations than they've had at any point during the entire pandemic. Social gatherings, family get-togethers continue to drive community spread in Hamilton County. Let's go up north to Cuyahoga County. Cuyahoga County is a lower level. They are just right at the level about, they're at 101 cases per 100,000, but they're on the watch list because of sustained increase in outpatient visits, sustained increase in hospitalizations, sustained increase in emergency department visits. They returned to the watch list this week in addition to exceeding the CDC's threshold for high incidence. The county, as I said, has a sustained increase in new cases, outpatient visits, and hospital admissions. Local health department officials report they're seeing double the case volume compared to just 2 weeks ago, double the case volume compared to just 2 weeks ago. They also report that hospitals are seeing increased inpatient and outpatient volume and that social gatherings continue to be a problem. Let's go quickly to the new red counties. Allen County joins the list this week. The county also exceeds the CDC's threshold for high incidence. In fact, they are quite high. They're at 345 cases per 100,000. The county has had sustained increase in new cases, also sustained increase in outpatient visits. Local health department officials report that much of the spread in the community is generating from family get-togethers. Hospitals are also starting to be impacted, they've added. Crawford County also at a very high incidence. They are also a red. They are at 296 cases per 100,000, almost 3 times the CDC's high incident level. Crawford is red for the first time. The county exceeds the CDC's threshold for high incidence, and they're just seeing a sustained increase in new cases and outpatient visits. Local health department officials have told us there's more. A third of their cases are coming from spread between family members. There are small church outbreaks, 2 long care facility outbreaks, but the majority of virus transmissions, they tell us, is coming from community spread, just all through the community. Wayne County is also a high level of cases, 256 cases per 100,000. They returned to red this week. They were last red the week of September 3rd. The county also exceeds the CDC's threshold for high incidence and is seeing a sustained increase in new cases, outpatient visits, and hospital admissions. Local health department officials report there was a significant outbreak at the College of Worcester. There have been some long-term care facility outbreaks, and the College of Worcester has recently announced that they are going remote. They have done a good job. They prepared, but the spread has just overwhelmed them in that sense. So they are going remote. Let's turn to Tuscarawas County. They're red for the first time this week. They're at a fairly high rate, 217 cases per 100,000, over double the high incidence rate. They're seeing sustained increases in new cases, outpatient visits, and hospital admissions. The Tuscarawas County Local Health Department reports they had a record number of cases on Monday, 41 new cases on Monday. 22 residents are hospitalized, at least 3 are on ventilators. Spread continues in families and in the community, particularly through social gatherings. Ottawa County is red for the first time this week. The county exceeds the CDC's threshold for high incidence, seeing a sustained increase in new cases. They're at 130 cases per 100,000. Health department officials report the county has had more than 90 cases to date in October, which is triple the number of cases they had in September. Like other areas of the state, people are socializing with friends, family, which is leading to additional virus spread. Hardin County, they're at 127 cases per 100,000. They returned to red this week. The last time the county was red was the week of July 23rd. County exceeds CDC's threshold for high incidence. They're seeing an increase in outpatient visits. The health department reports that events continue to happen and that they are having, unfortunately, some difficulty in getting people to cooperate in regard to contact tracing, which is really just essential if we're going to knock this down. Cuyahoga County, they are not a high incidence county. They're at 86 per 100,000, but they are red. For the first time this week, the county has seen sustained increase in new cases and outpatient visits. Social gatherings have continued, including get-togethers with family, friends. There's been a drop-off in people wearing masks. And again, while we haven't talked much about this, when we're talking about people getting together, many times the health departments will report that people were not wearing masks. And that, again, I'll kind of go back to what I've said is that many times you can do things, but you just have to do it a little different way. And wearing the mask, as Chris Christie said, is just kind of not a very big sacrifice to prevent the spread of virus to yourself or someone else. Lake County. Lake County is at 68 cases per 100,000, not a high incidence. The county has had sustained increase in new cases and outpatient visits. They have traced some of the virus spread to large social gatherings that then carried over into a workplace. They've encountered some resistance also with contact tracing. Let's go to Lorain County. Again, their incidence is 66 cases per 100,000. Again, not over the high incidence, but they returned to red this week. Last time they were red was the week of August 27th. County has had a sustained increase in new cases and outpatient visits. Local health department officials report spread from social gatherings, including sleepovers and some workplace transmission. So that's where we are.